Fire Division to order, and we do have a quorum. So the first order of business is to have a motion to adopt the minutes from February 24th. Okay, Representative Cleveland moves the minutes. All in favor, or sorry, any discussion, corrections? Seeing none, all in favor of the minutes from February 24th, say aye. 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 Yeah, opposed? Okay. Minutes are adopted. Yeah, I'm going to quickly just speak a little bit about the update on the coronavirus or COVID-19. So on Wednesday and Friday of last week, we got together in a bipartisan way with the Minnesota Department of Health and the governor's staff, both the House and the Senate leadership, and those on HHS committees. And we got an update, and I just wanted to quickly give you an update from this morning's meeting that we had, and there was a press conference, and so there should be information circulating. And there's a slide deck that legislators have been sent. But I quickly want to just update the public, and we're going to give a further update on Wednesday in Health and Human Services Finance, how the virus could affect our nursing homes and assisted living facilities in Minnesota. But first of all, there are no cases in Minnesota. So we've had 5 people get tested, and they've all come back negative. And this week, we'll be able to start testing, I think today, in our public health lab. We'll be able to test directly in our state in St. Paul. So those are 2 good points. But we do feel, I mean, experts do believe that we probably will see cases in Minnesota, that it's probably already spreading. We just haven't done enough testing. And so every one person who's infected could infect between 2 and 3 people. So that's the how it may spread. And so far, COVID-19, the fatality rate is 2.3% compared to seasonal flu, which is 0.1%. But SARS was 10% fatality, so it's much less. And if we're not testing, that 2.3% is probably overstated, since we're not testing everybody. People are going with very mild or no symptoms. Based on data from China, about 81% of their cases have been very mild, and 14% of the cases have been severe. So right now, I think we really need to thank our Minnesota Department of Health and all of the wonderful experts we have that have been doing a really thorough job of keeping all the legislators updated and tracking the coronavirus, and also know that we have very competent people who have been working on flu viruses for many, many years. And so we have really knowledgeable experts in the state that are tracking and giving us updates. And we'll get a full briefing on Wednesday in Health and Human Services Finance. So if the public would like to watch that committee, that's where you're going to get a full briefing from the Department of Health and on issues in the long-term care space. So I'm not going to entertain questions right now because there could be a lot. But if we have time at the end, you can ask questions. I have all the material here from the briefings. But we're going to do our bills today, and then if we have time, we can talk more about that. So the first order is I'm going to make a motion to re-refer House File 3359 to Health and Human Services Policy Committee without recommendation. And it should be in the folders, House File 3359. Do I take? No. Does anyone have a question about that referral? Seeing none, all in favor of that motion, say aye. Aye. Any opposed? Okay, motion passes. Okay, the first bill is 3557. Representative Masin, would you like to go to the testifier table? And if we have any testifiers that can join Representative Masin, you could do so at this time. Okay, so House File, make a motion that House File 35, oh, sorry, that's right. Representative Masin, would you like to move your bill?
I would, thank you, Madam Chair, members. I move that House File 3557 be recommended for placement, oh, wait a minute, I'm on the General Register. But first, I would also like to do the A1 amendment.
Okay, so we'll do the A1 amendment to get your bill in order. It should be in your packet, members. This just adds an effective date of July 1st, 2020. So any or upon federal approval, whichever is later. Any questions on the amendment? Okay, all in favor of adopting the A1 amendment to House File 3557, say aye.
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 Any opposed? Okay, amendment adopted. To your bill, Representative Masin, as amended.
Thank you. This bill has two purposes. To enhance the healthcare workforce that works with older Minnesotans, and it would restore equity in state policy between long-term care facilities and other health care sites. This bill addresses the lack of state support for training of health professionals in long-term care facilities, which has occurred since 2007. Last week, our committee heard from the Legislative Work Group on Alzheimer's disease, which offered a variety of recommendations to improve the care of older Minnesotans, especially those with cognitive impairments. This bill represents one of those recommendations in the report of that work group. To repeal the prohibition against the use of medical education research costs, known as MERC, grants for healthcare professional training in nursing facilities. Nursing facilities are the only training site excluded from MREC funding. And actually, it's MERC funding, sorry. The importance of these roughly 375 facilities to care for Minnesotans is clear, given that about 5% of those over 65 years of age live in such facilities, according to the 2016 Minnesota Department of Health study. About 7% of the nurses work on them. I'm going to, I know there may be other people that want to testify. Because this bill does not request additional funding, only slight reallocation of existing funding, there will be no fiscal note associated with this bill. And I can answer more, but we might want to see if there are people that want to testify.
Sure, thank you, Representative Masin. So we thought there initially would be a fiscal note, but with the amendment, there is no fiscal note needed because it's no cost. So are there any members here that would like to testify? I'm sorry, any people in the public that would like to testify in support or against the bill? No. So this bill came to the attention when we had a long-term care forum at the University of Minnesota, and a gerontologist came forward and said we really need training in our nursing homes to get ready for our aging population in the state. And so I think this is a really good bill, Representative Masin. I'm glad you brought it forward. And we should pass it, I hope, to improve training and get people working in the long-term care space with the MERC program, which is both a federally funded and state-funded program. Representative Gruenhagen.
Oh, thank you, Madam Chair. Yeah, on the amendment, it looks like we need a federal approval or waiver. So why do the feds have a restriction on using this grant money for training for nursing homes? Can someone answer that question?
Someone from MDA or from the DHS here that could answer that question. I think it's because we changed the program, and so anytime you change the program, you need a permission, but let's see if that's the case. You want to introduce yourself for the record and proceed? Thank you.
Hi, Ms. Chair, members, my name is Carrie Erber with DHS. The reason there is a need for federal approval is because generally the medical education funds have to go through a hospital or a hospital-related type facility. In the past, they hadn't approved the nursing facilities, and so we would have to work with them to get this approved.
Okay. Does that answer your question, Representative Gruenhagen?
Just a quick follow-up, Madam Chair.
Yep, go ahead.
Okay, yeah, so why did they have that in force? I don't understand why they put that in force in the first place. Why would the feds do that? And I know we probably can't read their mind from here, but what's your best estimate?
Representative Gruenhagen, members, I am not really sure what the regulation is on that. I don't know if Ms. Brenny can help me out with that, but.
Sorry, can you repeat the question?
The question was, why would the feds not allow the payment to go to nursing facilities? Okay, we would have to follow up on that.
Oh.
So my understanding is that nursing homes that initially were included in MERC funding, and then they were excluded initially, And now we're trying to include them again in MERC eligibility. And we know that some hospitals that own long-term care facilities do the training in nursing homes, but not all nursing homes are owned by a integrated hospital system. So we
Well,
just-
and Madam Chair, I think it's a good idea. So I just can't figure out why they would prevent us from doing that.
Well, we hope that the feds will approve it, and we won't have a problem. We'll see, though.
I'd like to
Find
blame
out.
somebody, but I just don't know who to
I'm
blame.
I'm happy to blame the federal government if we can. But we should try. So thank you, Representative Gruenhagen, for supporting the bill. Any other questions from members or comments? Representative Munson?
Thank you, Madam Chair. I had similar questions along what Representative Gruenhagen was asking about, why are they prohibited? But maybe you can answer how much money is available in the MERC funding between the state and federal programs, and then what percentage do you see going to the nursing facilities? Because obviously, if we drain one group of people from funding, that they're going to want, I see a bill coming almost immediately from them asking for, why did we cut their funding? So I'm just kind of figure out what percentages, there's a total dollar amount, and then what percentage you see going to nursing facilities. And then will they have to hire more staff to do the training, or are they already set up to receive the funds?
Thank you. Representative Masin?
Thank you for the question. And hopefully there's somebody here that first of all, I don't have the figures with me. So if there's nobody here that can provide that, which it seems there is, so we're in good shape.
Excellent. Please introduce yourself for the record and put the mic really close, because those mics haven't been working very well at the table.
Yes. Ooh. Okay. Thank you, Madam Chair and members of the committee. For the record, my name is Diane Rydrick, and I'm the Director of the Health Policy Division at the Department of Health, which administers the MERC program. Administering MERC was my first job with the state 20 years ago, so you're asking, going back to the ancient history of MERC here. The most recent distribution of funds was roughly $60 million. MDH administers it. The grant funds go to clinics and hospitals and other provider settings around the state. It might be helpful to know that the way the formula works for MERC is that it's based on the amount of public program revenue that a site has, not on the number of trainees that they have. So a facility that gets more revenue from state public programs would get a higher grant amount than one that does less, relatively speaking. At the time when nursing homes were excluded from MERC about 10, 12 years ago, they were receiving a very small amount of money, only about $6,000 to $8,000 a year. That would likely be different now because of changes in the formula. So they would likely receive more now than they did then. And it is a zero-sum game. So more grants to one type of facility would mean less for another.
Okay.
Representative Munson?
Thank you, Madam Chair. Thanks for the detailed answer. I guess so the other question is, would it follow the same formula going to nursing homes, then only nursing homes that accepted patients on public funding would be eligible to receive this MERC funds? Is that right?
Go ahead.
Madam Chair, Representative Munson, there is a distribution formula for the MERC grants that is in statute. So unless the legislature chose to amend that distribution formula, the funds would go out using the same approach that they do for any other type of site, which is based on revenue.
Thank you.
Thank you. Any other questions? Okay, any closing comments, Representative Masin?
Thank you. I would like to read a couple additional sentences. Dr. Edward Rautner, who was here at our last meeting, is out of tone, so I know he would have liked to have testified. So I'm going to read some of his comments that he gave me and why this bill is so important. He's responsible for training 170 U of M medical students each year in basic care of older persons. He is compensated for about 1/2 day per week for this role at the university from its MERC funding. Without any other types of support or resources, Dr. Rautner said he has not been able to identify any nursing facilities that will assist him in such curriculum, despite the obvious value of such nursing home experience for future doctors who will be almost universally caring for older persons who will need will be residing in these nursing facilities. And I'm thinking with all the publicity over the last week regarding the current epidemic that's going around, I think this is even more important. that we'd get the training into the nursing homes. So I would appreciate your support. Chair Schultz, I move, again, that House File 3557 as amended be recommended for placement on the general register. And members, I appreciate your support.
Okay, thank you, Representative Masin. So Masin renews her motion that House File 3557 be recommended for placement on the general register. All those in favor say aye. Aye. Any opposed? Okay, motion adopted.
Thank you.
Thank you. Okay, Representative Lippert. So now we're on to House File 3236. And feel free to move your bill, Representative Lippert.
Thank you, Madam Chair. I move that House File 3236 be recommended for re-referral to the Energy and Climate Finance and Policy Division.
It looks like you have an amendment. Okay, we're going to do the presentations first, and then we'll do the amendment. Is that how you would like to proceed, Representative Lippert?
I believe Representative Cleavorn has an amendment. But
I'm open to doing the presentation first, if that's what you prefer, Chair. Would you like a copy of the amendment?
It's only a paragraph. Okay, we'll do the presentations first, and then we'll do the amendment later.
Okay.
So just proceed with the testimony, please.
Thank you, Madam Chair. Members of the committee, House File 3236 is a straightforward bill. It establishes a grant program under the Department of Commerce in order to award energy efficiency grants to nursing homes. The request is for a one-time appropriation of $20 million, and the maximum grant awarded would be $500,000 per applicant. The executive director of the Northfield Care Center, Kyle Nordine, wanted to be here to testify on behalf of the bill today, but had a conflict. He did share his views in a letter that's included in your packet. In the letter, he explains that the Northfield Care Center is a 42-bed nursing facility built in 1969. They have 62 windows in resident rooms that they would like to replace. This upgrade would increase energy efficiency and the quality of life of the residents. The project, though, would cost over $300,000, and that's cash the nursing facility doesn't have. They could apply for a threshold project, one of the existing options available to nursing homes to make improvements, but the threshold project process doesn't provide upfront cash. This grant program would. Kyle said to me that if you don't have cash available, even if you know you'll save money in the long term, you simply put those projects down to the bottom of the list. So allowing nursing facilities across our state to make these energy efficiency improvements would save taxpayers money as we're reducing costs to nursing homes. It'll be creating good jobs through these energy efficiency projects, and it'll be a good policy for the climate as well. And so at this point, I'll turn it over to Dylan Sievers from Fresh Energy.
Thank you, Representative.
Please introduce yourself to the committee and proceed.
Thank you. Chair Schultz, members of the committee, thank you for the opportunity to speak. My name is Dylan Sievers, Senior Policy Associate at Fresh Energy, an independent clean energy nonprofit with over 25 years experience providing policy and advocacy research on energy issues across Minnesota. I'm here today in support of Representative Lippert's House File 3236, a bill that would accelerate Minnesota's transition to a cleaner, healthier, and more efficient economy by creating a grant program to assist Minnesota's nursing homes in developing and funding cost-effective energy efficiency improvements. Energy efficiency has a proven track record of success in cutting energy use and utility bills in Minnesota. Costing less than 2 cents per kilowatt hour to produce, energy efficiency is the state's cheapest and most affordable way to meet our energy needs. It is 3 times less expensive than new gas or coal and half the cost of new wind generation. As large energy consumers caring for their residents 24/7, Minnesota's nursing homes have much to gain by becoming more energy efficient. A recent report by the American Council for an Energy Efficient Economy states that through energy efficiency, the state can cut its energy use and greenhouse gas emissions by 50% by 2050, effectively getting us halfway to our climate goals. The report goes on to state that 40% of those savings will need to come from improving our buildings, which is important for Minnesota because energy efficiency is a major job creator that strengthens and supports our local economies. Energy efficiency is the energy industry's fastest growing and largest job sector and accounts for over 45,000 jobs located all across Minnesota. The large number and geographic diversity of Minnesota's nursing homes contributes to why this bill is good for all Minnesotans. Lastly, and of significance to this committee, is that improving the energy efficiency of our nursing homes and buildings has shown to have significant positive health and safety benefits to building occupants. By supporting energy-efficient nursing homes, we can ensure that our seniors and senior care workers are healthy and comfortable in their homes and workplaces, and that Minnesota is well prepared to meet the needs of its aging seniors for years to come. Fresh Energy is proud to support Minnesota's leadership on energy efficiency and proud to support Representative Lippert's House File 3236. I appreciate the opportunity to testify. Thank you very much.
Okay, thank you. Do you have another testifier, Representative Lippert?
Yes, Madam Chair. Bernie Hess is here as well.
Hello, Mr. Hess. Introduce yourself for the record and please proceed with your testimony.
Thank you. My name is Bernie Hess. I'm here today representing the United Food and Commercial Workers Union and other unions that represent over 10,000 hardworking folks in the nursing home industry in Minnesota. In too many communities around our state, good paying jobs are hard to come by. For many communities, nursing homes are the employer. We support House File 3236 because it will spur the growth of good-paying jobs in every corner of the state. We have over 400 nursing homes in Minnesota, and investing in them to make them more energy efficient is a way to reduce unnecessary energy waste, put people in the skilled trades to work, and to make those necessary upgrades and updates to the facilities. Energy efficient buildings will improve the health outcomes for our residents and working conditions for our members. Resident health and employee productivity are largely affected by the physical work environment, specifically temperature, air quality, and lighting. Energy efficiency measures can increase low ventilation rates, which will reduce the risk of transmitting infectious diseases and airborne illnesses. A healthier, more comfortable work environment improves productivity and decreases employee absenteeism. Further, it can reduce psychological stress, sick days, asthma symptoms, respiratory illnesses, and even chronic pulmonary disease and cancer. It will help create energy efficiency jobs as well. There are over 61,000 Minnesotans already working in the state's clean economy, and almost 75% of those jobs in energy efficiency. Everything from manufacturing windows to the workers upgrading and installing heating and ventilation systems. An estimated 40% of clean energy jobs in the state are in greater Minnesota. We'd like to thank Representative Lippert for bringing this bill forward, and we urge you to support it. Thank you.
Thank you, Representative Lippert and Mr. Hess. Are there questions for the testifiers or for the bill author? Representative Gruenhagen?
Oh, thank you, Madam Chair. Yeah, just Representative Lippert, you mentioned the threshold project. So that's a project that they could also apply for this type of funding. And I didn't catch what's the problem there?
Representative Lippert?
So thank you, Madam Chair, Representative Gruenhagen. So the problem, as I understand it, is that through the threshold project process, there isn't upfront cash made available. And so it's one option for doing projects that would improve a facility, but it's difficult for these kinds of projects because there just isn't that cash made available.
Representative Gruenhagen?
Oh, thank you, Madam Chair. Yeah, so if the threshold project's available for these types of projects, but there's no upfront cash, when do they get the cash? After the project is completed?
Representative
Or
Lippert?
how does that work? I guess, why, I want energy efficient buildings too. It's just the thing is, if we have a program already, I don't know if tacking another 20 million onto it is necessary.
Representative Lippert?
If somebody else wants to address it too, that's fine.
So, and I believe Kyle Nordine speaks to this some in the letter as well, that that because of the delay in, are you able to respond to it?
Please introduce yourself. And
Good afternoon. My
proceed.
name is Kim Brenny. I work in the Nursing Facility Rates and Policy Division at the Department of Human Services. Madam Chair, members, the answer to that is they get reimbursed after the project over a course of time in their rates, in their daily rates to the facilities.
So, Madam Chair?
Gruenhagen?
Yeah, so they do get the money, it's just delayed, and it's increased in their rates as far as their, what they're paid for the nursing facility. Do I understand that correctly?
Madam Chair, members, that is correct. There are certain guidelines, thresholds. I mean, it's called a threshold project because they have to spend a minimum amount, but less than the moratorium amount, and that dollar amount's changed every year, and there's other criteria, but they are able to submit projects like this or other types of projects and seek, so they're not getting paid right when the project is done. They're submitting their receipts to us, and we're reviewing that information. And then there's a formula that is used to make a rate increase for these types of projects. There are some facilities in the state that because of the property rate setting system, they would not be eligible for this. So not every single facility in the state would be eligible for this, but the threshold project is a rate mechanism for smaller projects like this.
Representative Gruenhagen?
Oh, the reason that I bring this up is, Chair Schultz and I were on a panel for some pharmacists over at the Capitol Ridge there. Thank you. Men always need a little help, by the way. No. We're sent all the facts I've received, all the way back to State Demographer Tom Gillespie, is our HHS budget is growing at a rate that is simply unsustainable. In fact, if it keeps growing at the rate it is, we're not going to have any additional money for K-12, higher ed, or roads or bridges. So, I just think we got to be real careful of just piling more money onto a system, however well intended, if there are other programs available. And maybe, I don't know if that's a federal program, federal and state, or a state program, maybe we need to modify that in some way rather than, spend another $20 million on the project or of money on there. And we all know we got more needs than we got money. And I think we got to really squeeze these, the additional dollars that we're putting in because of the rate of growth of this particular area in the state budget. So that's just, if you want to respond to that, those are some of my thoughts.
Representative Lippert?
Thank you, Madam Chair, Representative Gruenhagen. So this is a grant program through the Department of Commerce. So it's a separate pot of money. And what I'm hearing from nursing facility directors like Kyle Nordine in Northfield is that they aren't able to do these sorts of energy efficiency projects that they know would save them long term and would save taxpayers long term. So making these funds available would allow us to lower the burden on taxpayers through reimbursement over time. But that the obstacle is having cash on hand, and this grant program would allow for that.
So I just want to add to that so it's not in the Health and Human Services budget, but it will reduce the operational costs for nursing homes. So we don't have those cost savings necessarily in fiscal notes, but that's what nursing homes are telling us, is that it would save money over the long run. So Representative Gruenhagen?
Yeah, and I'd just say, I think we should try to tweak the current program that's available before we spend an additional $20 million. I mean, that's just my initial. I mean, there's always more needs in our state than we have money. And if there is a project available to do these or funds available to do these types of projects, and maybe it needs to be tweaked, I don't know. But I think we should look there first. Again, I'm not in any way trying to undermine your intent. I think your intent is very good, Representative Lippert. But I just think we got to squeeze every dollar that we spend in a way that if there's other money available, it's hard for me to support another 20 million on there without understanding how we might modify the threshold project to meet that need. Thank you,
Representative
Madam
Lippert,
Chair.
Do you want to respond to that?
Thank you, Madam Chair. Representative, I would simply say that I think this is a very, very cost-effective way to be investing these dollars this year.
Thank you. And Representative Munson, I think, has this question along similar lines.
Yeah. Thank you, Madam Chair. You probably guess. Representative Lippert, thanks for bringing the bill forward. I too have concerns about the cost of this, not only the $20 million, but the fact that the Commissioner of Commerce can be paid up to $1 million to administer this program over 2 years. That's also a concern because I see this a lot when the programs come through and we see all this money and then buried in the bill where it says that the bureaucrats in government agencies can spend up to 5% of the cost or whatever the number is on these bills. This one happens to be 5%, so that's $1 million going to the Department of Commerce for cutting some checks and reviewing some applications. And in the application process laid out in here where you go through the 8 points that you're going to be scoring these projects on, the first one, a reduction in energy uses in customer bills. I think you could argue that potentially you could reduce energy costs by spending $500,000 on some, solar project or something for a nursing facility, but whether or not you reduce customer bills through that same amount might not follow through. I don't know if there's enough scrutiny on that, but all the rest of them are really, positive impacts on the community. I think it's pretty subjective on how you can judge things, and I'm afraid reducing the actual cost isn't going to be the main reason why you're doing it. Reduction in fossil fuel emissions. I mean, I know that's your main agenda, but like the project that the letter came in from support, they're already 100% electric on their heat, which doesn't use any fossil fuels. But the author of the letter also says, obviously, this is not the most cost-effective energy solution because they're all electric. So concerns over the project, again, like Representative Grunhagen said, spending $20 million when we have so many needs out there for mental health in other projects, and we have nursing facilities that may not be the most energy efficient, but they're trying to prevent leaks and trying to keep afloat so that they can keep the lights on in their facility when they're losing patients, and as we're keeping more and more homes. So there's a lot of in my district, a lot of small nursing homes that only have capacity, and they're trying to figure out how to keep afloat. Also, I just had a question on the threshold project that you guys were speaking of. I know that the formula and how we pay nursing homes takes into consideration their energy efficiency. Is that what you were talking about with the threshold project?
Representative Lippert?
I may need my threshold expert. I think mostly related to the threshold project, the concern is related to just when that money is going to be coming in through the rates, and there's a lag in time. But
Can you state your name for the record one more time, please?
Kim Brenny, Department of Human Services.
Thank you.
So threshold projects can be used for a variety of things. They do not need to be clean energy associated. I'm not sure if that answers your question.
Representative Munson?
Thank you, Madam Chair. I guess my question is, in the funding formula to determine the rate that's allowed for a nursing facility, isn't energy efficiency part of that rate, or is it not part of that formula to calculate the rate?
Ms. Burney?
That is not a consideration when computing the threshold rate or the total nursing facility rate. Utility costs are part of the operating price, which is set by the Metro Median facility for all the facilities in the state. So it's really not a factor on any rate-setting component currently for nursing homes.
Okay.
Representative Munson?
Yeah, and just one further question, Madam Chair, or comment, Madam Chair, in the bill where we talk about the cost of energy. One of the reasons why electrical bills for nursing facilities are already increasing is because of energy efficiency projects that are put in by the energy utility company. I mean, Xcel Energy is talking about raising the rates by 15%. Also, Xcel Energy built ratepayers out of $150 million last year through energy efficiency projects, and then puts that into the bill for all the facilities to pay. So it's a lot of these projects are not being vetted on the economics of them, and that's also driving the cost for facilities up. So I think I have concerns over that, so I'll be a no vote on this bill, but I would hope that we can find a better use for the $20 million for greater needs for Minnesotans.
Okay, Representative Cleveland.
Madam Chair, could I
Go
respond
ahead,
quickly?
Representative Lippert.
Thank you, Madam Chair, Representative. So as you were talking, I was just thinking about the time I've spent with residents in their rooms in this particular facility, and the windows are very large and prominent, and the residents also like their rooms to be very warm. And so I can imagine this is not a very efficient situation if you have old windows that need to be replaced and have been needing to be replaced for a long time. So I'm trusting the head of this facility that they need some more cash available, and that this is a project that would help them lower their costs. And so I think we should be supporting them in that.
Okay, before we proceed, I just also want to note, to help answer Representative Munson's questions, is that if all of this money is not used, the remainder goes to the general fund. So doesn't mean that we're going to spend 20 million. There's 20 million available through this process for these projects. Also, this will go to Energy and Climate Finance and Policy Division, where they know a lot more about energy policy than I do, or maybe you do as well, and so they can maybe vet that further. But now I'm going to go to Representative Cleveland.
Thank you, Madam Chair and members. Representative Lippert, I want to thank you for bringing this bill forward. There is a nursing home facility that is in my city of Plymouth, but just outside of my district. And like your visits, when I visit people there as well, they too would like to have their rooms warm in an old drafty building. So I just want to say thank you for that. Madam Chair, my amendment is the A2 amendment, and it puts into, there is a correction that actually needs to be made on this. So if I could ask for
Would you like to move your amendment?
I would like to move my amendment.
So Representative Cleveland makes a motion to move her amendment 8-2 to House File 3236.
That's correct. And if you would look at line 1.2 of the amendment itself, it says before grants, insert A, but that is not singular, plural together. So it should say a grant, not a, is that incorrect? Thank you. Please help me.
Madam Chair, it's inserting a parenthesis
Oh,
A. That's the beginning of a
I
paragraph.
apologize. I read that improperly. Thank you so much for correcting my error. Thank you.
So we don't need to amend
So
it?
no amendment to this amendment. It is correct as it stands. Thank you.
Thank you, Representative Cleveland. So Cleveland makes a motion to amend House File 3236 with the A2 amendment. All in favor?
Well,
Oh, sorry.
Question.
Representative Grunhagen.
Oh, thank you, Madam Chair. Yeah, Representative Cleveland,
Yes.
my concern is I think this amendment adds prevailing wage to the bill. Is that correct?
That is correct.
And, Madam Chair,
Grunhagen?
according to the Minnesota Chamber, we have the 4th highest prevailing wage law in the nation. And it artificially inflates the cost of all government projects to the tunes of tens of millions of dollars per year. And I'd rather, let's let the market decide that. Let's not artificially inflate it. And I'll just give you one example from a town hall meeting a few years ago that I had. They were fixing a road out in my area, and one of the individuals who came to my town hall owned a gravel truck, and he charged $28 an hour to use the gravel truck. Well, they accepted him as helping with the road project, but they said, we're paying you $45 an hour. He said, I don't need 45, I charge 28. But they paid him 45, okay? So the effect of this is on the $20 million, is to use a lot of it up in a less efficient way to actually meet the needs of the people in the nursing home. Without your amendment, that money will go a lot further than it would otherwise. So, and hey, I'm all about paying people, a good wage. When I was on the school board, we were always in the top 2 or 3 in the conference in terms of our salary and benefits. But I think in this particular case, it would be nice if you withdrew the amendment and let the money be used in a more efficient way to help as many people as possible if this bill is going to pass.
Representative Cleavorn?
Yes, Madam Chair, and thank you, Representative. I appreciate your concerns, but prevailing wage requirements for state-funded projects like this support high-quality local jobs and our local contractors. They also ensure that the work is performed properly, and this will mean that we will actually see the energy, health, and environmental benefits be realized. And I just want everybody on the committee to know that these are local jobs that are good-paying jobs that can't be outsourced. So, Chair and members, I ask for your support for this amendment. Thank you.
Any other questions on the amendment before we take the vote? Okay, I want to thank Representative Cleavorn for bringing this amendment forward. I know having prevailing wages is important. It spurs the economy when we are paying people living wages, so it really does help local economies that may need it. Okay, so I'm going to call for a vote on the motion to amend with House File 3236 with the 8-2 amendment. All in favor say aye. Aye. Any opposed?
No.
Okay, so the amendment is adopted. Any other questions on House File 3236 as amended? Representative Keel.
I'll make this point. Thank you, Madam Chair. I'll make this point just because we're talking about prevailing wage. I think rural Minnesota has a different perspective on prevailing wage than the metro area does, and it does affect our ability to provide jobs for people and work. There is a difference. We hear from other businesses all the time that are able to do things or don't get jobs because of their situation. So that's not why I wanted to say anything at all. I am certainly on this bill. I understand the efficiency in making sure that our nursing homes are up to standards and are efficient. But one other way for nursing homes to be able to afford care is, remember last year, I think it was, that we were cutting nursing home funding. Nursing homes have to have that support in order to do their buildings as well as care for their residents. And so we have to remember that in order for them to be efficient and do the things that need to be done to care for our seniors or those who have disabilities, that we also need funding there. So I just want to make a point of that we talked heavily about cutting nursing homes last year, not something I was in favor of. And nursing homes are becoming far and few in my area. So we're ending up having to travel a ways to even find care. So this is important, but it is also important that we make sure we fund nursing homes. So thank you, Madam Chair.
Thank you, Representative Keel. Any other questions or comments? Okay, do you want to renew your motion?
Yes,
Representative
Madam
Lippert?
Chair, I'll renew my motion that House File 3236 be recommended for referral to the Energy and Climate Finance and Policy
As
Division.
amended.
As amended.
Okay, all in favor say aye.
Aye.
Any opposed?
No.
No.
Okay. Motion prevails, and the House file is on its way to Energy and Climate. Okay, Representative Lippert, do you want to take over as chair so we can do our last bill?
Ooh, yes.
Chair Schultz, we have a DE2 author's amendment in our folders. Would you like to move your bill and then your amendment?
Sure, I move House File 2153 and amendment, the DE2 amendment to House File 2153.
And to clarify, Madam Chair, you're moving that House File 2153 be recommended for re-referral to HHS Finance.
Thank you. I move the House File 2153 be referred to Health and Human Services Finance Committee.
And the chairs move the DE2 author's amendment. All in favor, say aye.
Aye.
Opposed? Motion prevails. D2 amendment is adopted.
This is
Chair Schultz,
Okay,
please
thank you,
explain your
Chair
bill.
Lippert. So this is, so last year we did a recod bill for the elderly waiver, and now we can bring this forward. This is elderly waiver. I'm sure as you, most of you know, it's for people who are over age 65 and need the level of care provided at a nursing home, but would rather remain in their homes and communities rather than an institution. So in 2017, elderly waiver program served close to 30,000 older adults at a cost of about $343 million of state and federal funding. These waivers allow Minnesotans an alternative to placing Medicaid-eligible individuals in hospitals and nursing facilities, and also provide services that are not covered or are limited under a traditional Medicaid program. This bill makes adjustments to the elderly waiver methodology to increase support for people on the waiver and to help improve wages for healthcare workers who are compensated through the waiver. It also makes changes similar to the changes we've made in 2019 to the other types of waiver programs. So we have inflationary adjustments. We're incorporating data from the Bureau of Labor Statistics to accurately understand the labor market trends and to calculate wages. We increase compensation rates and factors. So reimbursement rates for services or expands the factors that are used to calculate those payment rates. And we are increasing funding for home delivered meals, and all the changes would take effect January 1st of 2021. And I believe we have 3 testifiers today.
Great, if they would come forward. So I call Dan Pollock forward. If you please state your name for the record and proceed.
Thank you, Mr. Chair. And I'm going to have a friend join me, Carrie Benson as well, our Division Director for Aging Services. I'm Dan Pollock, Assistant Commissioner for Continuing Care for Older Adults. Oh, okay. Thank you, Chair. And I appreciate the hearing on the elderly waiver and rates issue. As you heard already when I did kind of the update overview presentation maybe 2 weeks ago, elderly waiver represents an emerging area or continuing area of concern for us because it is a population that could obviously qualify for nursing facility stay, but the rates are paid differently. It's a very different system from nursing facility and institutional level care. The workforce shortages that we know exist on the nursing facility side are probably even more existent on the elderly waiver side because they are community-based services, and employers in that sector are competing with Target and retail employers for qualified staff to come in and do basic level services, the kinds of things you'll see in this fiscal note for homemaker or chore services or meal delivery, just really important, critical components of living independently. So we'll walk through some of the ways that the rate system works and some of the issues that we've been looking at and trying to implement a piece of this from 2017. And then, I just want to reiterate that we also are acutely aware that the other components of our support services system, the alternative care program, which is really designed for people who are a little bit wealthier in terms of their assets, and I say a little bit, they have about 6 months worth of assets. Roughly 2,000 or 3,000 of those folks also could end up in elderly waiver eventually through a spend down, and unfortunately the federal government is not really recognizing the way that they used to the enormous value that that program presents to the state and to the federal taxpayers. And so we've had to renegotiate some of the terms of that waiver, and you see that in the fiscal note as well. Basically, loss of FFP as we increase elderly waiver rates. FFP is a federal match, so we would lose that federal matching dollars as we increase the elderly waiver rates. So I'll turn it over to Carrie to kind of walk through this presentation and talk a little more detail about how we run this program.
Please state your name for the record and proceed.
Mr. Chair and members, my name is Carrie Benson. I'm the Director of the Aging and Adult Services Division at the Department of Human Services, and in that role, I also serve as Executive Director of the Minnesota Board on Aging. And as Dan mentioned, I will go over fairly briefly information that I believe you have as handouts before you as well. A little bit more background on the elderly waiver program and some of the trends that we're seeing and provide a little bit more context in terms of the bill that's before you. The elderly waiver program is a very critical component of our efforts to balance the long-term services and support system for serving older adults in our state. And it really does allow us a very important piece of relying less on nursing facility services, of course, supporting more individuals in the community, as most of us would prefer as we're getting older and need some help and qualify for publicly funded programs. We would really prefer to receive those in our own home in the community, and it ensures that older adults have meaningful choices. So this program has been in operation for quite a long time. And serves people through a defined service menu, but then offers choices for flexibility too. In terms of who we're serving through this program, you'll see that just over 30% are age 85 and over. So this is clearly serving individuals. They do meet nursing facility level of care criteria, but they're staying in their homes. So this is a pretty robust set of services that we're able to provide through this program for individuals who are 85 years or older and really at the end of their life. You know, we serve people typically about 18 months through this program. We are serving an increasingly diverse population through this program, and we see that across all of our programs and our state population overall. And so you'll see there's proportionate changes, just even looking at 2013 to 2017. Is the data that we were able to quickly pull for you today, but it shows a trend that we do see continuing in the programs. Most people who are served through elderly waiver, or a sizable proportion, I would say 38%, are in living alone or living at home with family or friends in their own home in the community, while about 30% are living in a congregate setting. Trends in terms of service utilization, and then the next slide will show spending, show a gradual increase in the number of people that we are serving through the program. So as the population ages, we do see then, of course, an increase in the number of people who are then eligible for this program, as well as our other federally and state-funded home and community-based services programs for older people. So in 2017, it was about 29,000, a little bit over 30,000 is the number we're serving right now. Again, similarly then, with that increase in the number of people, we see the increase in cost overall gradually over the years. This next slide shows you EW services with the greatest growth in utilization. So this shows the increase in the number of people who are receiving one of these services in the elderly waiver program. For some of these, well, first I will talk about customized living. So that is the name of this service bundle that people receive in assisted living settings through the elderly waiver program. So that's the payment source for them in assisted living settings. And so that is an area of the elderly waiver program, or a component that we are seeing a higher rate of growth in than in other service areas or service types. Somewhat similarly, but at a little bit slower rate of growth, we're seeing in waiver transportation and then adult day services. We're seeing increases in that higher than relative to some of the other services that we pay for through the program. Those last two, waiver transportation and adult day, are services received outside of an assisted living setting. Although, of course, if you're in an assisted living and on receiving customized living, that could be a part of what the service array that you are receiving. But it's important to see, just as we look within the program a little bit more deeply, a little bit more of what's going on in terms of the trends. As was mentioned previously by Chair Schultz, that there was legislative changes. You all authorized a new rate and methodology and then a report to follow. So in 2017 and subsequent increases in rates and overall budget limits for elderly waiver, as with some of our other programs. We have them listed by acronyms, unfortunately. So you have elderly waiver, alternative care, and then essential community supports are the abbreviations after one or more of these services as they're available through these programs. The rates are calculated using a few different factors here. So we've got the base wages calculated for each service rate or component service rate, and the bill before you, I believe, shifts the calculation for all of the wages now to the standard occupational classification codes from the Bureau of Labor Statistics. Additional cost factors you have listed before you. These are basically a breakdown of all of the other factors that were identified by providers of these services in working with us through a provider cost survey and through the evaluation that we were able to contract with Navigant Consulting to inform the calculation of these costs. First, the identification of, and then the calculation of these costs. So the degree to which any of these factors inform the overall cost for these services varies, of course, depending on what exactly it takes to deliver the services. What are the costs incurred? So starting in January 2019, there's partial implementation of the rates, so that was a 10% with the new methodology. And there's a lot more detail and information related to the implementation of those rates and how that pans out for each of the services. There's a hyperlink available for you here, and then in the following slides, a little bit more detail as well. But even with the partial implementation, there was some effect. There was some effect on each of the services by the new rate setting methods. So there was a 10% implementation and some ways to go in terms of getting full implementation of the methodology, which would result in full coverage or payment for the costs incurred to deliver any one of those services. So as I mentioned, we conducted an evaluation under contract with Navigant Consulting. And I would say, again, as a very major component of that evaluation, we did a provider cost survey that really drove quite a bit of the development of the actual rate factors, component factors, and we had a stakeholder advisory group that we worked with quite closely. The following slides, I might, for now, skip over those briefly because it starts to delve into a lot of the detail that I'm not sure is what you might want to go through at this time. But you can refer to each of these because they start going into which services there is a change that was recommended regarding the base wages. And then that is followed by then explanation on the non-wage factors. So as I said, those are the two main buckets of cost factors that feed into then the overall rate recommendations that were the result of the evaluation. And so it's a different mix per service based on the actual cost. And finally, what I would like to end with is just another note. It was noted earlier that the home delivered meals rate, that there was a separate increase included, I believe, and change potentially in the methodology related to home delivered meals rate in the bill before you. So that rate was set in 2017 at a dollar value of $9.30, and then recommendation to change that to the $8.17 again. Once we had that cost survey data available to us, then we're really wanting to make sure that we provide you with the information that accurately quantifies what the actual costs are for any one of these services. The recommended rate values that you have before you is basically an example of, for some of the services, where the rates were January 1, 2019. So for instance, if we just take the first one, adult day service, the 15-minute unit, the rate was $3.45 in 2019. The recommendation was to increase that about 25% to the $4.32 for that unit, 15-minute unit rate. And so you'll see the percent increase recommended through the evaluation for any one of these services varies quite significantly, and that shows the degree to which the historical rates for these services were falling short of the costs that the providers were informing us as far as, and then the evaluation was validating the costs at. So that's also information that we wanted to make sure that you had available to you, and of course a lot more information in the evaluation itself and the recommendations per service. Again, another part of that list of services here on the next slide. Other recommendations, I already mentioned the full implementation of the new rates, updating the rate methods and rate calculations every 2 years. I believe you'll see that noted as well in the bill before you. And then applying the rate setting methods and rate values to line up as far as timing wise. That makes it much easier in terms of implementation and efficiencies for our lead agency partners in terms of implementing that, and for the providers. And then to conduct ongoing evaluations too, so we can really make sure that that we are lining up the rates with the costs incurred. The last item that I wanted to bring to your attention, because it is a part of our elderly waiver program and one that we have been very excited to implement, was established by the 2019 Minnesota legislature. You authorized and funded the customized living quality improvement grants. So we have $1 million available currently here in the current state fiscal years. It should say 2020 to 2021. Little typo there. Mm-hmm. But we are very excited to be working with providers who came forward to submit quality improvement projects, and these are providers specifically delivering customized living services for EW recipients. And so they responded to the RFP, our first one. Proposals were due in December, and so we're still currently in contract negotiations and trying to finalize those as soon as possible. And then we will be able to let everyone know that final list of successful responders and what those grant projects are about. But very excited to have that additional investment, and really in particular that it helps us support quality improvement efforts too. Thank you.
Mr. Chair,
yes.
Just one other thing I didn't touch on. In your packets are copies of the Future of Elderly Waiver Report, and I think we have a couple copies for the public as well, but this is downloadable. And this is a really good source document. This topic gets pretty complicated pretty fast, and it goes into a lot of its pictures, so it's not that bad of a read. And I think it does really do a nice job of explaining kind of how we approach this this program and this service sector.
Thank you, Commissioner Pollack, and thank you, Ms. Benson. I believe, sure, are there questions from the committee at this point? Representative Gruenhagen.
Oh, thank you. Thank you, Mr. Chair. Yeah, thanks for the presentation. My understanding, and correct me if I'm wrong, these are people certified to be in a nursing home, but they're staying at home or staying in a group home, correct?
Ms. Benson. Mr. Pollack.
Mr. Chair, members, yes, that is correct.
And then just,
Representative.
I got a couple follow-ups. And did I hear you correctly, Assistant Commissioner Pollack, we lose federal Medicaid dollars on this, or didn't I understand that correctly?
Mr. Chair, Representative Gruenhagen, the Elderly Waiver Program has an interaction and a relationship with the Alternative Care Program. So they're two programs for the same population. One The population in alternative care has about 6 months worth of assets, so they're in a spend down into the Medicaid program, but they're not quite there yet.
Are they federal or state?
Well, we had been receiving 50% federal match on that program, and recently we were able to renew the 50% federal match, but with a lot of strings attached, and we were disappointed with some of the requirements. And with this bill, if you were to pass this bill this year, because this bill substantially increases the elderly waiver rates, we would have to abandon the waiver for alternative care. We would lose federal match for alternative care.
Representative?
Oh, thank you, Mr. Chair. So basically, it would be coming just out of state Medicaid dollars then, correct?
That's correct. Mr. Chair, Representative Gruhan.
Okay.
Representative?
I'm sorry, I'm trying to wrap my head around this proposal. I guess, you know, when I look at the fiscal note, and maybe Mr. Berg can answer this, based on looking at his face, he's not sure, no. So this is an increase of the number of people taking advantage of it, this fiscal note, correct?
Mr. Berg?
Mr. Chair, Representative Grudenhagen, it's an increase in the cost of the people. I haven't gone through to see if there is an assumption of greater uptake. There probably is. No? Same?
It's just cost.
So it's just updating the rates. It's just increasing the cost of the rate based on the same assumptions of uptake.
Representative?
Oh, thank you, Mr. Chair. So I'm to assume we're not seeing any increase of people using the elderly waiver? Or does this fiscal note show some type of an increase, just for clarification?
Assistant Commissioner? Thank you. Please state your name for the record.
Mr. Chair, members, my name is Carrie Erber with DHS. This fiscal note basically looks at the, like all the forecasted dollars for elderly waiver, AC, alternative care, and increases the rate of the assumptions with all the different factors that are in the bill. So there's not really an increase in the number of people.
Representative?
Oh, thank you for your indulgence, Mr. Chair. Okay, so we're assuming the same amount of people, it's just the cost is going up, correct?
Correct.
Mr. Berg?
Okay, Mr. Chair, just to follow up.
Yep.
Do we, under this fiscal note, by people using home and some group home care, it's costing us less than if they were in the nursing home, because these people are certified to be in the nursing home. Is that correct? Whoever would like to answer that?
Mr. Chair, yes, I believe that's correct.
Okay,
Representative.
Thank you, Mr. Chair. Yeah, so and I just want people to understand this. Because we have static fiscal notes, we can't take into consideration the savings from not being in the nursing home. Now, if you would have passed my bill a couple years ago, we could do that, and we'd actually show a savings on this, okay? So for people, I guess this is a good analogy on static versus dynamic. Static means you're precisely wrong, okay? Which is what this analysis is. Dynamic means you're approximately right, because you can take into consideration the savings in other areas by people not being in the nursing home. You'll actually save money on this program by getting people to stay at home, which I favor, because with the amount of baby boomers coming up, we need to find ways for people to stay at home and family members to take care of them and still deliver services, because it's much more cost effective. Final comment, Mr. Chair?
Representative, and then we'll move on to other testifiers.
Yep, I'll be done. I would take the automatic inflation factor out of here. I think they should come back to the legislature to get approval of additional costs. That's just a suggestion. At that time, we could also review the program to see how it's going. If you just put it in there automatically, we know how that stuff goes, okay? The other thing, I have a relative who just went into a nursing home, and her husband was a veteran, and she qualified for about $1,100 a month in veterans benefits towards the cost of the nursing home. Now, I don't know if veterans benefits would help out in a situation where somebody's staying at home or in a group home, But Mr. Pollack seems to be shaking his head. Maybe he could respond to that.
Gruenhagen.
Mr. Chair, Representative Gruenhagen, actually, there is a veterans program that does offer those kinds of benefits, and it's one we've been trying to publicize a little bit more. It's a little bit complicated to get in because you have to work through the VA system, and they have different rules than we do for state programs. But our local area agencies on aging are equipped to help folks enroll in that if they are veterans.
Thank you. I believe we have 2 other testifiers on our list. They would come forward. Okay. Please state your name for the record and proceed.
My name is Libby Chaprin. I'm with Leading Age Minnesota. I'm here today on behalf of the long-term care imperative. Thank you to Representative Schultz for bringing forward House File 2153. This important bill establishes rates for all EW services that reflect the actual cost of providing the service. This includes, as you heard from Ms. Benson, customized living, adult day services, home care, and other community-based services. The new rate will address the gaps between the current rates and the actual cost of care that, according to a 2019 DHS study, are anywhere from 10 to 50% below the cost of care. Moreover, it improves the methodology by updating rates over time to reflect the cost of providing services and to prevent gaps from redeveloping. By making these reforms to elderly waiver, we will ensure that seniors have access to high-quality home and community-based services throughout the state. We look forward to the ongoing conversation regarding this important issue. Thank you.
Thank you, Ms. Chapman. Mr. Pearson.
Mr. Chair, members, my name is Toby Pearson, Care Providers of Minnesota. Today, on behalf of the Long-Term Care Imperative, we'd like to thank Representative Schultz for carrying this bill, House File 2153, and the changes to elderly waiver. The Long-Term Care Imperative does support this bill. As we approach a time when more than 1 million seniors are living in Minnesota, the growing demand for services and the rising cost of care are making it difficult for families and older Minnesotans to afford the right level of senior care. At the same time, seniors are living longer and are able to live more independently if appropriate services are provided in their homes, senior apartments, or assisted livings. Elderly waiver balances senior care needs with the desire to live independently and actually lowers the monthly cost of care while preserves the quality of life for seniors. The Elderly Waiver Program is an effective way to ensure quality care and independent living for qualifying seniors while reducing the burden on the state budget. For those reasons, the Long-Term Care Imperative supports this bill.
Thank you, Mr. Pearson. Are there questions or comments from committee members at this point? Any additional testifiers who wish to testify for or against this bill? Any further comments or questions from committee members? Chair Schultz, do you have any closing comments?
I just want to thank the committee members for hearing this bill. I just want to address Representative Gruenhagen's question about inflation. So the updates are every 2 years, an odd number year, and we go back and look at the data from the BLS to see what's happening with wages. And then we're basing the increase on actual data to keep up with wage competition so we don't have future shortages in this sector.
Mr. Chair.
Representative Gruenhagen.
So, thank you, Ms. Chair. So then, at that time, when we look at that, does that come back to the legislature for review, or does it just happen automatically?
It happens automatically here, but we at any time could come back and change the rate formula if we so choose.
Representative Munson.
Thank you, Mr. Chair. Representative Schultz, I just have a quick question. I don't know if you're following what's happening at the federal level for funding and for long-term care, but if the federal government were to increase funding for these programs, would that be tacked on to our payments, or is what you're doing is setting the rates and whatever the federal government covers, they cover? Is that how this bill is written?
Chair Schultz.
Thank you, Chair Lippert and Representative Munson. That is my understanding, that we would replace our state funding for this with whatever federal funding we can use and maximize those federal funds to pay these rates.
Representative?
Okay, that's it. Thank you.
Chair Schultz, will you renew your motion?
Sure, I renew my motion to refer House File 2153 as amended to Health and Human Services Finance Committee.
Thank you. Chair Schultz renews her motion. All those in favor, say aye.
Aye.
All those opposed? Motion carries. Chair Schultz, would you like to discuss anything else before we adjourn today?
I think that's all we have. I just want to note that next week we're going to be working on personal care attendance bills.
Great.
You can
Thank
close
you.
this out, Chair.
Okay. With that, the meeting's adjourned.